Back to Daybreak, it is 9:26. You or a family member could be living with diabetes or be pre-diabetic and not know it. That's the case for millions of people, according to the CDC. So how do you learn and change your path? Community health dietitian Colleen Kilberg is with me this morning. We're going to talk about the disease and the risk factors as it is Diabetes Awareness Month. Thanks so much for coming in this morning.
Thank you.
Let's start with, how does that happen? How can you be sick and not know it?
Well, with diabetes, there are symptoms out there that most people get automatically, like being very thirsty, using the bathroom a lot more, being more tired, fatigue, and just they think they just have the flu or they just don't feel well.
But this is long-lasting because it's chronic.
Correct.
And so at one point, do you need to see a doctor, and who are we most talking to out there?
We're talking to those over age of 60 who've had risk factors in the family. Women who had gestational diabetes, African Americans, people that are overweight, those are all high risk for diabetes in general.
Okay, and at what point do you need to see that doctor then?
Actually right away.
Yeah, okay, so as soon as you think you have any of the symptoms on that list.
Correct.
Let's talk about the severity of diabetes, because some may not be as familiar with it to know that, I mean, there is just a laundry list of complications that can come of it. It's not just about, oh, you don't get to eat sugar anymore.
Right. It's more of knowing what your number is. The most important thing about diabetes really is to know your A1C. It's just the letter A and the number 1 and letter C. And what that is, it shows an overall average of your blood sugar over 3 months. So it's over long term, not just today and tomorrow. It's what happened 3 months ago. That's the best way to determine what your blood sugars are and how your diabetes is controlled.
Can you describe what life is like with someone who has diabetes, who has gone through, I mean, we can talk about skin health and the ability to walk and the calcification of your heart. I mean, there's just so much that can happen. Kidney disease.
Just like you said, there's kidney disease. Some patients will end up on dialysis. Heart disease, they can lose legs, they go blind. There's a lot of major complications with diabetes.
Not something to be ignored.
Exactly.
So now is the time. You don't wait any longer if you are hearing what we've mentioned here with some of these. What is the next step once you have been diagnosed with diabetes?
Education. That's a huge component of all diabetes. You need to know what you need to do, like nutrition, exercise, checking your blood sugars, taking medications.
Okay, there's your call. You have some information now arming you. Call your doctor next if you think there's some more information on your screen on how you can get help in this National Diabetes Month. Thank you so much for coming in, Colleen. We appreciate it. We have more Daybreak coming up after this.